There are many Chinese herbs that have a reputation for beneficial health effects. Most of them have been used in traditional Chinese medicine for thousands of years, so they have a long track record. In Western research, when some of these herbs are looked at closely, some of the traditional benefits pan out, and some of them don't, for reasons that I really couldn't explain. Today I'm going to be discussing another one of these Chinese herbs, and the reason why I'm discussing this one at this time is because I just came across a study, a very interesting study, that showed that this particular herb might be of benefit to bodybuilders and athletes or anyone else who's interested in muscular hypertrophy. So let's talk about this herb. The herb is Astragalus. Astragalus. These things are always hard to pronounce. Again, it's been used. There's over 2,000 species of Astragalus, and but only 2 of them are used in supplements. And I'm not even going to, I don't know if I should even attempt to pronounce them. Astragalus membranaceus and Astragalus it looks mongolicus. The membranaceus, whatever it is, that's the one that's most commonly found in supplements. And Astragalus has another unique property. One of the ingredients is the basis of a very popular so-called pro-longevity drug I'll talk about a little bit later. But let's talk about some of the basics of Astragalus. It's specifically the root of the plant is used to make it's made into different types of supplements, liquid extracts, capsules, powders, and teas. Sometimes it's given by injection or IV in a hospital setting. It has the root contains all kinds of compounds, a lot of saponins, all these various natural plant compounds. But the basis of Astragalus, the reason why it was used in traditional Chinese medicine, is because it's thought to be a potent immune stimulator, and also it seems to reduce inflammation. As a matter of fact, there was one study where they gave Astragalus in combination with drug treatment to treat viral myocarditis. That's an inflammation of the heart caused by a virus. Some people young men between the ages of 20 and 24, 1 to 2% of them who take the COVID-19 injection get short-term myocarditis. It's not dangerous, doesn't kill them, it doesn't cause permanent heart damage, and it's easily treated with the usual drug route. But I'm wondering if maybe they added astragalus to it, maybe the treatment would work even better. But then again, the type of myocarditis that these young men are getting are not caused by the virus, but they're supposedly a reaction to the COVID-19 vaccine, which again occurs in only 1 to 2% of young men who take the virus. I mean, the antiviral injection. Astragalus, as I said, it's known to boost the immune system and increases your production of white blood cells, which are an essential part of immunity. It's research with animals shows that Astragalus helps to kill bacteria and viruses in mice, and it also might help with viral infections in humans. Some studies show, again, these are all Chinese studies, by the way. Almost everything you find in the medical literature on Astragalus is Chinese in origin. Very few Western studies done on it. But some of these studies even suggest, because it so greatly raises immune function, that Astragalus can help protect against the common cold. I don't think that's been confirmed in Western studies. Some studies show that Astragalus can improve heart function in those who have certain types of heart conditions. It seems to widen your blood vessels, increases the amount of blood pumped from your heart. Patients with heart failure were given 2.25 grams of Astragalus twice daily for 2 weeks, along with conventional treatment, and they experienced greater improvements in heart function compared to those who received only the standard treatment. In another study, patients with heart failure received 60 grams per day of Astragalus by intravenous route, along with conventional treatment. They also showed more significant improvements in symptoms compared to people who only had the standard treatment alone. Other studies of astragalus in heart failure have shown no benefits at all, so, it's hard to say. Other studies show that astragalus may help relieve some of the negative side effects associated with chemotherapy. One clinical study in people undergoing chemotherapy found that astragalus given by intravenous route reduced nausea by 36%, vomiting by 50%, and diarrhea by 59%. Other studies have demonstrated benefits of astragalus for nausea and vomiting in individuals undergoing chemotherapy to treat colon cancer. And in still another study of 500 milligrams, again, IV intravenous astragalus 3 times a week improved the extreme tiredness associated with chemotherapy, but it only worked for the first week of treatment. After that, it didn't do anything. Some studies indicate astragalus can be useful to helping to prevent or control diabetes. Diabetes, of course, is a failure to properly utilize glucose. There's 2 types. Type 1 diabetes is caused by autoimmune reactions that destroy the beta cells in the pancreas that produce insulin. The other more common type is type 2 diabetes, or it used to be called adult onset diabetes, and this has to do with insulin insensitivity and, again, a failure to utilize glucose in the cells because of less cellular sensitivity to insulin, which causes an elevation of blood glucose, hyperglycemia. Hyperglycemia is associated with a short lifespan. It's not good for you. And diabetes is something like the 4th or 7th, I can't remember, leading cause of death. Most people who die from diabetes die from complications such as congestive heart failure. In China, astragalus is one of the most common herbs given to treat diabetes. Animal and test tube studies show that astragalus seems to improve sugar or glucose metabolism and reduces blood glucose. One animal study showed that it also led to weight loss. It seems to work the same way in humans. However, the amount is pretty high. For example, studies have shown that taking 40 to 60 grams of astragalus per day has the potential to improve blood sugar after fasting and after meals in people with type 2 diabetes who took it daily for 4 months. Astragalus may also improve kidney function. It increases blood flow in the kidney, and it increases. It also seems to prevent a complication often found in diabetics, which involves proteinuria or the excretion of excess protein by the kidneys. It's also called albuminuria, and it's an indication of early kidney problems. Usually the treatment is a calcium channel blocker, such as, I think it's a calcium channel, I don't remember, but lisinopril is one of them. That's the drug they use to treat it. But apparently astragalus can also be useful. It seems to improve the proteinuria in people who have existing kidney disease. It can prevent infections in people who have reduced kidney functions. One study showed that taking 7.5 to 15 grams of astragalus daily for 3 to 6 months reduced the risk of infection by 38% in people with a kidney disorder called the nephrotic syndrome. That's only one study. It needs further follow-up to see whether it really works. And again, I have to point out, a lot of these studies involve animals. And from the studies from China did involve human subjects, but they're, again, almost all from China. There's not a lot of American or Western studies to prove the efficacy of astragalus. Doesn't mean it doesn't work. It just doesn't mean that. It just means that there's not a lot of, let's say, American studies to back it up, and a lot of scientists kind of only accept American studies. That's the way it is, because American studies are usually a little stricter in their design and this and that. Some studies show astragalus can improve symptoms of chronic fatigue. It seems to help 160 milligrams twice daily, reduce the sneezing and runny nose associated with seasonal allergies. I think one of the most important, one of the most interesting things about astragalus is an extract of astragalus called, it's actually a proprietary formula. It's called TA65, and it's the dose usually given is 10 to 50 milligrams daily. It's patented by 2 companies, and they've had a couple of studies on it. It's the studies published by the companies that sell it. That's an important point. Remember, they have an ulterior motive to push this stuff. They showed a 2 to 3 point fold increase in telomere length in isolated skin cells. Telomeres are the ends of chromosomes, and every time a cell replicates, the telomere gets shorter and shorter. When it gets to the end of the telomere, a cell undergoes something called cell senescence, which means that the cell stops replicating. It's more or less dead. It just sits there. Senescent cells are a major cause of aging. I'm not going to get into that here. Suffice to say that TA65 was thought to be one of the natural, effective ways to keep your telomeres length longer. When they gave it to female mice, it also seemed to relieve a couple of symptoms of aging: osteoporosis, insulin resistance, liver fat buildup. They were attenuated. But the problem with let me see here. The problem with TA65 is twofold. First of all, it's extremely expensive. It costs like $1,000 a month. But even worse than that, it only 1 to 2% of it is absorbed orally. And a study of female mice showed that giving the mice 25 milligrams per kilogram of TA65 did not significantly extend lifespan, nor did it increase the incidence of cancer in mice. But at about the actual extract from Astragalus, that's TA65, what it is, it's called Astragaluside 4. And that's what TA65 is. I don't think it works. I think it's a ripoff. But that's that. But one of the reasons why I wanted to make this video was because of a new study that came out that involved isolated muscle cells. Once again, this study emanated from China and Taiwan. Brand new study just came out. And what they did is they exposed these myotubes, or isolated muscle cells, to a same form of astragalus that's sold as a supplement. And they found that the supplement stimulated the same anabolic pathways in muscle, or isolated muscle anyway, that are stimulated by anabolic hormones such as insulin-like growth factor 1. So it's interesting, and the study suggested that Astragalus might be, or its derivatives, might be promising candidates to help prevent sarcopenia, or the loss of muscle with age. Of course, if it actually stimulated muscle growth, it would be of interest to bodybuilders too. And I know somebody's going to probably leave a comment under this video about how much Astragalus to take to produce anabolic effects. I couldn't tell you, because this is a preliminary study that involved isolated muscle cells. For all I know, it might not even work that way in an intact human body. We know that it stimulates muscle cell growth in isolated muscle cells, but whether it does that in actual, human muscles remains to be seen. That would have to involve a human study, what they call a placebo-controlled study, basically, where one group received actual Astragalus, the other group received a placebo. Both groups engaged in resistance training, and after a couple of weeks, they checked to see whether the Astragalus group actually showed greater muscle gains. You'd have to do a couple of studies of that to show that Astragalus was truly anabolic. But this initial studies is pretty interesting, because again, it stimulates the same pathway that's stimulated by amino acids, steroids, and insulin-like growth factor 1. Now, what about side effects? Usually, Astragalus is usually considered a safe herb. Some minor side effects have been reported: rash, itching, runny nose, nausea, and diarrhea. When it's given by intravenous, it usually involves greater dosages. There's possible more serious side effects such as irregular heartbeat or arrhythmia. If you're going to give it by IV, it should always be done under medical supervision. The dosages of Astragalus for average person. I don't know, again, whether this would produce anabolic effects. Nobody knows yet, but it varies between, the effective dosage is 9 to 30 grams a day. For blood sugar control, it's 40 to 60 grams. Kidney disease, 7.5 to 15 grams. Chronic fatigue, 30 grams. And I think that's about it for Astragalus. So interesting possibilities. Could actually be still another anabolic natural substance, but that remains to be seen. You have to have human studies. You can't go by isolated cell studies. So, yeah, I think if a couple of supplement purveyors, if they come across this study, I wouldn't be surprised if they start throwing it in their anabolic supplements or calling it a testosterone booster or something like that. But don't fall for that. I mean, there's no real evidence as yet, as I said, that it'll work in an intact human body. So I think that's about it for Astragalus. If you want further information on, you see this microphone I'm using? I went back to it. I used my microphone a couple of videos ago, and people really liked the sound. They said it came off better. However, the next video I made, I again attached the microphone. I thought everything was going good. I recorded like a 25-minute video, and I wasn't paying attention to the timer. It turned out the video didn't come out at all. Nothing happened. It wasn't taped. And I got pissed off, and I said, well, that's it for the microphone, because that never happens with the built-in microphone with my webcam. But I'm giving it another shot with this video. You can see it right in my hand. I'm holding it here. So, I'm sure the sound will be good. If this video comes out all right, I'll continue to use this microphone, because apparently the sound is a lot better. So if you want further information on nutrition, exercise science, anti-aging research you can use today, ergogenic aids, hormonal therapy, did I say, I said exercise science, supplement science, which supplements work, which ones don't, women's health and fitness, many more topics. I cover more topics in Applied Metabolics than any other digital publication, and I also have over 60 years of experience that can't be matched by anybody. I don't care if they have 42 PhDs. They're not going to match my experience in the trenches, in the gym. I know what works and what doesn't work. I've also trained. If you look at my biography on the Applied Metabolics site, you see I've trained with some of the greatest bodybuilders in the world. I've interviewed them because I wrote for bodybuilding magazines for about 35 years. I know everything that works, everything that doesn't work. I know the science, and I know what science and what is bro science, and I avoid bro science in Applied Metabolics. So you'll only learn the truth. I'm not trying to push any supplements, any products other than Applied Metabolics. Even when I have to mention a commercial product in Applied Metabolics, I only use a generic reference. In other words, I'm not a shill to sell supplements for companies that I'm not even associated with, and I'm not associated with any supplement companies. So that's that. So subscribe today at www.appliedmetabolics.com. When you subscribe, I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on medicine, science, nutrition, and exercise. I also have an email portal on my Applied Metabolics webpage where current subscribers only. I don't accept unsolicited questions. Current subscribers can ask me short questions about anything they might have read in Applied Metabolics, or anything that comes to mind, as long as it requires me to a short answer. I don't want to go into. I'm not going to give like 42 pages, something like that, which I don't think anybody would read anyway. The attention span these days seems to be about 4.2 seconds. But anyway, and by the way, Applied Metabolics is written in non-technical language. Anybody who's gone as far as the 6th grade will easily understand it. Any technical terms that I do use in the publication, I readily explain, so you don't have to reach for a science dictionary like you would with many of these other digital publications, which read like medical journal articles. So it's not that they're bad information, they're just difficult to get through. I try to keep my Applied Metabolics entertaining. I talk about little anecdotes from the so-called golden days of bodybuilding, when I trained at the original Gold's Gym with people like Arnold Schwarzenegger and others. So again, subscribe today, www.appliedmetabolics.com. It's anywhere from 30 to 50 pages every month, and I guarantee you'll learn something. I promise you. I cover topics that are kind of off the road that you won't find in blogs, videos, and all that kind of stuff. So again, www.appliedmetabolics.com. If you want to have the best friend you'll ever have, go to your local shelter and adopt a dog. Take care.